Due to COVID-19, New York State faces huge funding shortages. Without federal relief or new revenue, lawmakers may cut some state funding streams by 20%. This includes behavioral health care. Families Together in New York State set out to talk to parents and youth to share their experience and show how crucial their behavioral health has become. These are their voices.
Kaiser. I am a certified peer support specialist in New York State. I grew up in the Bronx, and I currently live in Albany, New York. I'm a parent of a child on the spectrum. And in terms of his own mental health, because autism has comorbidities that also involve things like anxiety and depression, for my son, it has been good academically because he has limited distractions for virtual education. However, the isolation is a concern, so that now when he does venture out, his anxiety levels are raised, which has led to some telemental health appointments. It has led to some tweaking of medications. And it also has led to the need for me to really engage in more skill building activities with him as a parent. COVID-19, as a lot of folks know already, has impacted the Black and Brown community very heavily. Within my community, my immediate community, and the broader community where I spend my time, both locally, statewide, and nationally, it has been rough. It has really had an impact on the level of hope that our families have within the community. Because the message that is being sent to my community in terms of Black and Brown folks, urban folks, is that you're not mattering. It's also led to a reinforcement of the destruction of hope. The struggle was rather typical in engaging in services and having to engage in some reinforced advocacy with systems to get the services that I needed for my son. There were not adequate resources for communities, in particular within the urban hubs as well as the rural hubs. Access to care, wait lists, finding a provider that a family is comfortable with, the amount of choice that families had, and even for myself that I had, were very limited. We have had a steady rise in suicide rates and suicidality, admissions to crisis stabilization units, repeat in and out of residential facilities. So prior to COVID-19, it was a bad situation. To take this situation and to cut any amount from that budget is nothing less than a sin, because what you're doing is you're committing this group of people to a future that is not only very uncertain, but also very, very, very likely to result in a lot of lot more suicides, a lot more crime, a lot more prison admissions. You're going to be beefing up the criminal justice system. You are going to engage in a culture and contribute to a culture where people are not going to get the help that they need. Cuts to a system that's already broken. What I want people to know, and the people who are the decision makers, the change makers, they need to understand that living in poverty, these children who are not getting the proper services through mental health will be going out into communities where they will be more easily victimized. where violence will increase, where gang involvement will increase, where mothers will be going to funerals for their sons who could have had the help if the budget was not cut. What you're doing is you're creating a future society where you will have to pay on the other end of it.